Margaret, Minister, I was just wondering about in relation to the actual decision itself. There was a lot of hospitals applied for their site, hopefully to be selected. People are concerned about how that decision was actually made. There's been no sort. Like I've trawled the media in relation. I've listened to yourself in relation. So in relation to the interest of transparency, how we actually came to that conclusion. Because there's many hospitals out there that would feel that they fit a lot of that criteria in relation to that, including the one in my own area in relation to that. Deputy Maloney asked about the ambulatory care centre. There was also talk in relation to a maternity element coming out to Tallow. I presume that will now be knocked on the head in relation to that. I think the question's already been asked about the future of Crumlin Hospital in relation to it. Also in relation to it was linked to the development of the Mater Hospital. What will happen to Temple Street Children's Hospital? And lastly, I know you said in relation you have no concerns in relation to possible planning difficulties down the road, but there is difficulties in relation to the site. Historically, there's sites on it that that's going to cause major problems in relation to planning. It is going to access is going to be the problem again that people raised in relation to the Mater Hospital. And again, any fool that travels in that area any morning in relation to it, that tries to get in and out of that hospital presently knows that there's major difficulties there. So I do detect that there's going to be problems in relation to I know you were confident that there wouldn't be the same problems, but there is concern locally in relation to many of the matters and how it's going to impact on them. Thank you.
Minister.
Thanks very much. Yeah, just in response to Deputy Maloney, the Development Board remains in place, and many of the people on that board, their term of office will expire on the 5th of December. I have stated publicly that I wish to engage with them to see what role they'd see for themselves into the future. I did say on radio yesterday that some people have interpreted this in some sort of a negative way. I see it as a very positive thing. I think the people who served on the board served very well. I regret, as I'm sure they do, that it wasn't possible to build at the Mater, but the planning risk was too high, too significant. But I have absolutely no doubt that many of those people can have a role into the future, and I hope that they will avail of the opportunity to do so, particularly in the area of philanthropy. I would be concerned, as Deputy Maloney is, about any sense of let's just get it over with quick. This is not a case that's suitable to that approach at all. There's a lot of complexity, and I suppose I'd be answering what Deputy Crowe has raised here too. There's still a lot of difficult work to be done, a lot of difficult decisions to be made in relation to this hospital, and I don't underestimate the planning difficulties whatsoever. And at no point did I say I had no concern about planning. I still have concerns, and I acknowledge that in the report, in fact, by saying that the risk is moderate and has been mitigated significantly by the fact that the original site, which was 2.44 hectares, has now been expanded to 6.2 hectares, so we have a much greater site to operate on. In relation to those who have expressed concern some earlier during the debate and who may not be here, I mean, the issue of tri-location is very much on the cards. We have ample room on this site to not just build a National Paediatric Hospital, but to also build a maternity hospital there in due course. As we all acknowledge, this country faces a very serious financial challenge, and the funding just isn't available to do a tri-location at the moment. But I would hope that we will be able to achieve that goal, and certainly there's sufficient land left there for that, and indeed other developments into the future. The nomenclature of the hospital is something that will attract a lot of attention, I have no doubt, and there have all sorts of discussions been had around how we might decide that, and indeed whether or not there should be a competition involving the children of the country in that regard. So, I mean, that question remains open. In relation to the ambulatory urgent care centre and the scope around that, well, clearly no, there were 3 areas that we couldn't actually make a final decision on until the site was agreed. One of them was the ambulatory urgent care centres, because until we know where it's going, which we now know, we couldn't determine how many of these centres we would need. The original plan was 1 in Tallaght, but perhaps we need more than that, 2 or 3. And we need to examine that now, and we'll do so very quickly. The other areas were the areas of governance, obviously, and the area of information technology, and those areas have been aggressively addressed as I speak. I'd like to just say that in relation to the Coombe going to Tala and that whole area around that issue, nothing has been decided there yet. The process, I believe, is important and will be very important to all those people who were involved in the bids. And I said in my opening remarks that I wanted to thank all of those for the efforts they put into that. And each and every one of the bidders in relation to the hospital groups made very, very genuine and well-intentioned bids for what they felt was the best option for the future treatment of children in this country. And I acknowledge that and I thank them for it. But the process was very fair, open and clear, and the reports will be made available and will be published. So there can be no question or doubt that something as major as this, that will have to serve our children for a number of generations, as Deputy Maloney has said, was anything but done in the best interest of children themselves and affording them, in the shortest time possible, the best environment in which to receive what they often already receive, which is the best treatment.
Thank you. Deputy